If the more conservative measures are felt to be inadequate, we can then take the next step and be more aggressive. And there are several ways to do this, which are minor surgical procedures. The first way is using what's called neuromodulation to help control the bladder better. The bladder is intimately regulated by the nervous system, and to some degree an overactive bladder can be thought of as an imbalance between the nerve impulses to and from the bladder. Neuromodulation targets these nerve impulses to affect how they interact with the bladder, and we use that to help control the bladder better. One can think of it almost as a pacemaker for the bladder. And we do this in two stages, with the first stage actually just being a test to determine, will this nerve stimulation actually help the bladder? And if the patient passes this test, if we see a significant enough improvement in their urinary symptoms during the test phase, we would then actually do the implant procedure, where a small device, almost like a pacemaker, is implanted under the skin to help control the bladder better. The second option is to use Botox. The same medication that's used to flatten out forehead wrinkles can actually be used in the bladder to calm down the hyperactive bladder. Botox weakens or relaxes spastic muscle, which is why it works in the forehead to weaken the forehead muscles. We can use that in the hyperactive bladder muscle to calm it down to help control the urinary symptoms. It's a very minimally invasive procedure, basically involves a scope looking into the bladder, and then we have a special needle that lets us inject the Botox into the muscle of the bladder. It takes about 15 minutes to do and can often be done under a local anesthetic. There's a small risk that it'll actually weaken the bladder too much, and that can create difficulties urinating. The effects tend to wear off after about 6 months, and so the procedure has to be repeated once or twice a year. But for many patients, this can salvage conservative therapy failure.